Just 5 years after COVID-19, China has another health problem, a virus called HMPV. This virus isn't new, scientists found it in 2001. But now, lots of people in China are getting sick with it. It's not just HMPV though. The flu, another virus called Mycoplasma pneumonia, and even COVID-19 are also going around. This is making it hard for hospitals and doctors in China, kind of like when COVID-19 first started. HMPV usually causes mild cold symptoms, but it can be dangerous for older people, babies, and people who are already sick. Videos and posts online from China show crowded hospitals and busy doctors. We don't know exactly how many people are sick, but it looks like a lot. The Chinese government is trying to be ready, like they learned from COVID-19. They are watching for any signs of pneumonia and making labs and health officials report any new cases. This helps them track HMPV and other viruses quickly. HMPV feels like a cold or the flu. You might cough, have a runny nose, get a fever, have a sore throat, or have trouble breathing. Most people feel a little sick, but HMPV can cause bigger problems like bronchitis and pneumonia, especially for babies, little kids, people over 65, and people with weak immune systems. Hospitals in China are very busy right now. People are posting online about crowded hospitals, long waits, and not enough medicine. Videos show sick people, many of them older, in hallways because there aren't enough beds. The Chinese government says there are a lot more people with breathing problems now. HMPV isn't the only reason, but it shows how busy the hospitals are. People are worried about whether China can stop the virus and help everyone who is sick. Other countries are watching what's happening in China. India told its people to be careful and try not to get sick. Hong Kong is also watching closely because it's close to China and worried the virus might spread there. Even though things look bad in China, experts say don't panic. Dr. Atul Goel, an expert on viruses in India, says HMPV isn't new and we know how it acts. He thinks it's spreading in China now because it's winter and people get sick more easily in the winter. Kan Biao, a disease expert in China, agrees. He says hospitals are busy, but things are okay. He says the government is working hard to stop the virus from spreading. Like with colds and the flu, washing your hands, covering your coughs and sneezes, and staying away from sick people helps stop HMPV. If you feel sick, stay home, even if it's just a little bit. There's no special medicine for HMPV, but you can take medicine for pain and fever. Drink lots of water too. If you feel really sick, especially if you're older or already have health problems, go see a doctor. Scientists are trying to make a vaccine for HMPV, which would help prevent it in the future. This takes time, but it's good news for stopping HMPV later.